Good morning. Spark Mississippi started about 6 years ago with a $5 million grant from the W.K. Kellogg Foundation. We were approached by the Kellogg Foundation to talk about their initiative in 7 states that's called Spark. It means Supporting Partnerships to Assure Ready Kids. And we were asked to pull together a group of people to talk about what an initiative in Mississippi would look like. Unlike many of the other states that were involved, Mississippi is one of 3 states in the southern region that does not invest any state dollars in early childhood education. All of the resources coming into the state for early childhood education in child care centers comes from the federal government in the Child Care Development Block Grant. And then we have the Head Start program. We pulled together a group of people, including Kathy Grace and many of the people that you've heard talked about here. There's a brochure in your packets that lists some of the Spark Mississippi partners. We are working in 5 school districts over the last 6 years. The school districts are Hollandale, Cleveland, Pearl, North Bolivar, Mount Bayou. And we work with Head Start programs, child care centers, public schools, and parents. The program initially was scheduled to last for 5 years. We started working with young children and tracking children, about 1,000 young children at the age of 3 in these 5 school district catchment areas. We moved into the 6th year because the state changed the time when children would take the MCT2 test from the 2nd grade to the 3rd grade, and we wanted to see how well we had done with those children. And we have evaluation results now, preliminary evaluation results on our 1st cohort, and the 2nd cohort is coming out of school this year. They will take the test in May of this year. When we started working in these communities, guided by a very influential and smart group of people in early childhood education. I'm not a specialist in early childhood education, I'm an organizer, and I know what I don't know. So we brought everybody to the table from the Head Start program, the education directors from Head Start, from the child care community, from the Center Institute for Disability Studies, the Cooperative Extension Service, all of these organizations that, 1, knew about the issue, 2, had resources to bring to bear on the issue. And we formed a state advisory committee who guided the work over the course of the 6 years. When we started, we learned something very troubling. There's not a lot of money in early childhood in the state, but there's also not the money that is in the system is not providing the amount of impact that we could possibly, the best impact we could possibly be having, because the system is not aligned. We learned that in many of the child care centers in here, and I also want to say about child care centers, Laurie said they are small businesses. But keep in mind that child care centers in this state that are serving the most vulnerable children, the children who have been described as not having the home environments that lead to their best development, the child care centers serving those children that receive resources from the state of Mississippi are reimbursed for that child care service at about a middle range of 65% of market value. Now that is like saying, I'm going to sell you a car and I'm going to allow you to pay me 65% of what it cost me. So when we talk about quality in these systems, we have to realize that many people are doing this because they love children and because they want to support those vulnerable families. And all of the children don't even get to go through those systems. So when Laurie talks about the kinds of things that you have to put in the system, it's very critical that child care centers have access to those resources so that they can, in fact, provide services for children. When we started working in these communities, we learned that child care centers and Head Start centers were not communicating with each other. That, in fact, child care didn't like Head Start because Head Start pulled their 3-year-old and 4-year-old children out of the centers, which were their money makers. that Head Start and public schools, but really public schools didn't like nobody. They thought they were in charge of education, and didn't nobody else know anything about educating young children. Until we got to the kindergarten teachers. And we had teachers come to us in tears and say to us, we can't deal with what's coming into our classrooms. And now in this environment of budget cuts and everything, and we're laying off teacher assistants in those younger grades. So we're not holding steady. But I want to say back to Spark. We looked at the resources that were there, and we started aligning the systems between child care centers and Head Start programs, so that Head Start had something that it could offer a child in need, for instance, dental services or hearing services or doctors, that we made sure those children who had been assessed for these needs received those services. And then we started going, when the children started moving into public schools, we again thought, okay, our job is 3/4 done. And we realized that schools weren't prepared to receive young children, that early childhood education is not a priority in a K-12 setting, and that school boards don't understand early childhood. So I say all of that to say that over the last 6 years, we have been engaging parents, and between the school settings, wherever that child was, if they were 3 years old, those children were assessed, parents were told what the children needed, we were providing the remedial services there, and Blake is coming to get me. But let me just say that working between the parent, the settings where the children are, and the public schools, we have been able to make a substantive impact on the children that are in the program. I'd like to close by just reading a section from our external evaluator. Overall, Spark Mississippi students outperform students in the comparison group in each performance level, being in math and language arts. In addition, when compared to all students in Mississippi taking the MCT2 test in spring semester 2009, Spark Mississippi students outperformed or performed as well in both mathematics and language arts. It can be done. We work in our communities with something called local children's partnerships, and we are now moving into collaboration with Excel by 5, so that these local children's partnerships are made up of businesses, educators, healthcare providers, parents, child care centers, Head Start programs, public schools, and the like, so that people sit down and talk about what the needs are in their community and how to best educate their children. We hope you will take a look at the material and join us as we move forward and trying to move Mississippi forward. Thank you.